Knee replacement surgery has come a long way, and robotics has a lot to do with that. Joining me now is orthopedic surgeon Dr. Fabio Orozco, medical director of Orozco Orthopedics. First of all, how do robotics work?
Well, thank you, Robin. The way that robotics works is we do a 3D CT scan, and with that 3D CT scan, we're able to template the knee replacement on this patient. So basically, we can do about almost half of the surgery before we even make any incision. I'm able to size the knee, position the components exactly where they're supposed to be for that particular patient, realign the leg and balance the ligaments, and those things usually have to be done during surgery in a traditional knee replacement. All those things we can do before we even make any cuts. After that, we're able to go inside the knee, don't cut the tendon, be less invasive with the tissues, which is just part of surgical technique, and then the cuts are done with a robotic arm. What that robotic arm brings is tremendous precision, and that allowed us to use components that are different than the traditional components. We can use components that are cementless, so there is no need to use glue to attach the components. So that's basically the process. Is in general less invasive. Surgery actually takes less time and is much more precise than traditional knee replacements.
How does that make a difference to the patient?
That's a great question. The technology is still very new. I've been doing it for 4 years, so we don't have long-term results. But because it allowed us to use implants that don't require cement, the idea is that these components can last for a longer time because it's a biological attachment instead of glue. This becomes really important because nowadays younger patients are actually getting knee replacements and they expect to have knees that can last for a long time. So that's one of the best ways that robotics can help our patients.
Good news for a lot of people. Thanks so much, Dr. Fabio Orozco of Orozco Orthopedics. I'm Robin Stoloff, and you're living well.